Good afternoon, folks. It's Robert Chappell, Executive Editor of Madison365 with your daily update for Monday, October 18th. It is Monday, which means it is Metcalf's Monday. Metcalf's is a fourth-generation family-owned and operated market with stores in Madison at Hilldale and behind the Westtown Mall and in Wauwatosa at 68th and State. They work to support local farmers and produce, and right now, you'll find so many local fall flavors like apple, pumpkin, and squash. Order for pickup or delivery anytime at shopmetcalfs.com because there's still a pandemic and it's just easier, right? The update today also is brought to you by the UW Division of the Arts, which believes that, if I can find my script here, Division of Arts at UW-Madison believes that arts are for everyone, everywhere. Their online arts hub is a great resource for finding arts events and opportunities. Discover how to be a part of the campus arts community by visiting go.wisc.edu/arts events. That is, one more time, go.wisc.edu/arts events. And we appreciate their support of Madison 365 and the daily update. We're talking through some COVID numbers, which are looking pretty good today. I mean, one hates to be optimistic. I guess I shouldn't say one hates to be optimistic. One tries to be realistic, right? I don't want to give the sense that this is over by any means, but I kind of feel like we're getting there. We've said that before, right? In the spring, when vaccines were going and everybody was getting vaccinated and everybody was trying to get vaccinated and numbers were going down, everything seemed like it was good. And then things got bad again. And now they're getting better again. So I don't want to say like, hey, everybody, good job, we did it. But I mean, I'm feeling pretty good right now. These numbers that I'm going to give you in isolation are bad, right? If I just told you that we had 2,158 cases every day, new cases confirmed every day for the past 7 days, that's a big number. That's bad, right? If I told you the 7.9% of all cases in the past 7 days, 7.9% of all tests in the past 7 days came back positive, that's very bad. Both of those numbers are remarkably better than they have been, though. So we don't look at these numbers in isolation. We look at trends. And the trends right now are downward. So we'll take that as a win. We'll understand that these numbers are still high. We still need to be doing the things we're doing. We still need to be masking in public. We still need to be getting vaccinated, right? We still need to be being cautious about gatherings. My concern is we're going to get complacent and everybody's going to let their guard down. A whole bunch of unvaccinated people are going to have Thanksgiving dinners together, and we're going to go out of control again in November, December. I don't want that to happen, but I do want to recognize that things are good right now because I don't want to overplay it either. I don't want to try to scare anybody either, right? We don't want to be complacent, but we also don't want to scare you. We want to give you the facts. So the facts are today we report 1,192 new cases. That's low. That's on the low side for a Monday over the past several Mondays, right? Mondays are typically lower than other days of the week, so I would expect more than 2,000 cases tomorrow, just because of the way they do the testing and the reporting and everything over the weekends. However, the 7-day average smooths all that out, right? You can smooth out the differences in the days of the week by giving us a 7-day average, and that average is 2,158. That's about 50 less than it was on Friday. So not a dramatic decrease over the weekend, but still a pretty good one. The 7-day positive test rate on Friday was 8.2%. Today it's 7.9%. That's also very good. That's like been a precipitous drop in the past week and a half. As of the 5th of October, it was 9.2. So it's gone from 9.2 to 7.9 over 2 weeks. Also not a huge decline, but a downward trend over a period of time. Right? If that continues, in a month from now, we'll be back below 3. I'm not real optimistic that that'll continue quite that far, but we'll see. We will see. Now, the Deaths average also came down to 15 per day. 0 confirmed deaths yesterday. That's good. We haven't seen a 0 death day in a month or two. And the average falls to 15. I would expect to see more reported yesterday because, again, these deaths are not deaths that happened today, but they get reported today. They just aren't doing that reporting. It's sad, right, that we're talking about people's lives and we're talking about them as paperwork. But the paperwork doesn't get done over the weekend to confirm the death certificate from the death that happened 4 weeks ago, right? So we'll see 0 deaths today and 30 tomorrow, or possibly. That's what we saw last week. Right? We saw like 0 on Sunday, a few on Monday, and then 39 on Tuesday. Not because 39 people died on Tuesday, but because that's when the paperwork got done to confirm those deaths were COVID deaths. Right? It's difficult to reduce lives to data and paperwork, but that's the situation. So, but it is still good news that the daily death confirmed or reported average is coming down. Hospitalizations also came down, and we don't have a good sense of exactly how it went over the weekend, but I can tell you they must have gone down a lot over the weekend, because today we are at 1,061 people hospitalized, which is lower than it was Friday, but 23 more than yesterday. Right, which means it must have the hospitalized with COVID population must have gone down by about 50 over the weekend, and then back up a little bit today, which is fine. There's 23 people more today than yesterday. 1,061 people total. That's 118 fewer than a week ago. That's a slightly more, well, I guess right around a 10% decrease in the hospital population over the past week. There was a moment there in August and September where it was going up 10% like every day, right? So to have it come down 10% in a week, that's great. The ICU population also came down over the weekend and has come back up slightly over the Monday, the day today. It's 313 people currently in ICU. That's 24 more than yesterday. So that's actually kind of a big jump. However, that total, 313, is still lower than it was a week ago. So again, that trend, even though both those numbers are up today over yesterday, the trend over time is still downward, which is good news. Our vaccine total is now at 54.7%. It's slowly inching and creeping its way upward, just a little bit at a time. And we'll get there. I suspect we'll see a big jump, a big surge in vaccines as soon as it gets approved for kids under 12, which we are anxiously awaiting in my household. My kids are very excited about getting vaccinated. It's a little weird, but they are. All right, so now the Wisconsin Leadership Summit started today. It was a really good day. 5 really powerful panels on business, career stuff, networking stuff, nonprofit leadership stuff. And we have 4 more days of that. We'll talk a bit more about that and some other news. But first, I have to talk about some WLS, Wisconsin Leadership Summit sponsors. Summit Credit Union is one of the sponsors. And the Wisconsin Leadership Summit, sponsored by Summit Credit Union. This is a coincidence that they are called Summit, and this is called the Summit. Summit Credit Union is all about helping you turn wishing and wondering into planning and doing, whether in your financial life or in your career. Summit Credit Union, would love to help you thrive. Visit summitcreditunion.com to learn more. And the summit is brought to you by the Tamara D. Grigsby Office for Equity and Inclusion. Their mission is to promote excellence in public service through the development of an inclusive, equitable, and sustainable county government. So if you want to get in on this Leadership Summit, it is still happening for 4 more days. It's a week-long virtual event. You can register still at wisconsinleadershipsummit.com. I'll drop a link in the comments. Tomorrow, all 5 panels are focusing on education, disparities in education, careers in education. And then Wednesday is all about social justice. Thursday is health and wellness, and Friday are the affinity panels where different ethnic groups will talk about the issues important to their specific communities. So don't miss it. Get in on it. It's really fun. It's really good stuff. Let's talk about some other local news, though. There's another event coming up November 5th and 6th. The University of Wisconsin-Madison has its diversity forum, which is an in-person event. One of the keynotes is going to be Dr. Zhang, and I regret that I don't remember his first name. I'm sorry. I should be more prepared. Dr. Russell Zhang, co-founder of Stop AAPI Hate, which is an organization that traces its origins to the beginning of the COVID epidemic, when some people decided to blame China for COVID, and as a result, Asian American and Pacific Islander people got a lot of hatred and racism. And he started this organization, the Stop AAPI Hate Reporting Center, to track it. He's an academic. He's a professor at San Francisco State University, and is learning a lot in his research about this phenomenon and how to stop it. And that he'll be the keynote then at the UW Diversity Forum, November 5th and 6th. Also coming up tomorrow and Thursday, the Blacks for Political and Social Action of Dane County is having their annual State of Black Madison Summit. These are 2 evening events, each one 90 minutes. They're focusing this time on the physical and mental health of Black Madison in connection with COVID-19. So looking at how COVID-19 has affected Black Madison and how we're going to survive it. Look at this powerhouse panel. Dr. Corinne Reddy Moore is going to moderate. Dr. Diane Gooding, professor of psychology. Dr. Cheryl Henderson, expert on everything to do with COVID because she is a pediatric infectious disease specialist. Dr. Jasmine Zapata from DHS, and Dr. Justin Moore, pediatric health physiology at EW Health. Really powerful panel, and the details for that are on the site now, Madison365.org. Also in local news today, we got the official confirmation of what we knew, what we heard from a defense attorney, that when police tackled a young man on State Street over the weekend, and the police announced that a police officer had been shot, everybody assumed that this kid had shot the police officer. In fact, another police officer shot that police officer, which we knew pretty quickly. Didn't hear that from the police department. Police department just says there was an officer involved shooting, and the young man's attorney told the real story in court, that one cop shot another cop, and now the Department of Justice, which is investigating the incident, has confirmed that finding. So that's fun. In national news, the trial of the men who killed Ahmaud Arbery began today, with jury selection. That'll take several weeks, I'm sure. And finally today, former Secretary of State, the first Black Secretary of State of the United States, Colin Powell, passed away. He was 84, and he died of COVID-19. He was fully vaccinated. However, as a cancer patient, his immune system was compromised, and the vaccine, therefore, was not as effective for him as for other folks. That is the news for today. Appreciate you sticking with us. Again, the Wisconsin Leadership Summit continues all week. Starts tomorrow, 8 a.m. Goes 8. The panel started at 8:15. Go to about 4:15. You can dip in and dip out. It's a virtual event, so you can, there's no travel expenses involved. It's $49 for the whole thing. It's $29 if you work for a nonprofit or a government, and it's $19 for a student. So pretty affordable. And a lot of times your boss will pay for it because it is a professional development event. So give it a try. Check it out. Thanks very much for sticking with me. Really appreciate it. We'll be back tomorrow with another recap of the summit and some other more local news for you. Until then, have a good night. Take care.
This is 365 Media.